Hello, we're going to get started. My name is Christy. I'm with Metro Council, and I'm pleased to introduce you to Anita. Metro Council is a collaborative membership organization represented in multiple public mental health systems of community behavioral health centers serving greater metropolitan Kansas City. We provide support to our member organizations and education, information, and resources to the public on accessing quality health services. We host Mental Health KC Conference every May, as well as providing free webinars on the second and fourth Thursday of every month. Just a reminder, the views and opinions presented are those of the speaker and do not necessarily represent the opinions of Metro Council. At the end of the webinar today, we'll put the link and password to get the certificates of attendance for the webinar. I am excited to announce and introduce Anita Johnson, presenting Empowering Transitions, Rethinking How We Treat Older Adults. Anita earned her graduate degree from Mid-America Nazarene University in 2008. She's extensively trained in a range of evidence-based therapeutic modalities, including parent-child interaction therapy, trauma-focused cognitive behavioral therapy, dialectic behavioral therapy, acceptance and commitment therapy, eye movement desensitization, and reprocessing, and internal family systems. With over 20 years of clinical experience, Anita has worked with diverse populations across the lifespan. She's supported youth and families in building healthier relationships and more resilient lives. She has also worked with adults navigating life transitions, including challenges related to aging and older adulthood. Before joining Beacon, Anita was a therapist at PACES, where she provided care to children, adolescents, and their families in both individual and family therapy settings. So I am pleased to turn this over to Anita Johnson, representing Beacon Mental Health. Anita, it's all yours.
Hi guys. So, what I thought, let me share my PowerPoint. So sorry, you guys. Let's see. Let me see. There we go. Um, Give me a sec. I just had it up. I'm sorry, you guys. Just give me a hot second to figure this out. Sorry about that, guys. So, right now, I think what I'm going to do is show the agenda that what we're going to kind of discuss. So today we're going to talk about, I'm going to share some statistics, some reasons and why um, mental health is important to address with our aging population, some assessment tools, but really the assessment tools is not necessarily, it's just we're going to use it as a framework so you can kind of notice the signs of when you might need to start looking for help because assessment tools should be really used by people that are trained in them. So just so you'll know that, we're going to talk about some evidence-based practice. Yes, we are going to talk about positive um, treatment modalities, CBT, wisdom, and then I'm gonna kind of throw in a little bit of DBT in there a little bit as well as we go through our slide. Um, so, I would like to share a few statistics to show why the care of older adults is so important and why we need to look at it differently than we do children or adults. Older adults tend to plan suicide to ensure completion. 1 out of 4 will succeed versus 1 out of 200 in youth. Now, before I kind of get into some of the statistics parts of it all, I know I cannot talk today, y'all. But I had got to thinking like there was an incident where I had, you know, you know how you get a message about card fraud. And one of the things that they said to verify that I am who I am is through sending me a text. And I got to thinking, well, what if I was, an older adult who doesn't know how to text? It's like little things like that and how that can really sometimes affect your psyche. And not to mention, you're stuck in the middle of a country and you don't even have access to any means to help, you know, pay for anything. So, um, but instead of me reading through all these statistics, like I said, what really stuck out to me when I was researching this was the fact of they, how the elderly population, I was kind of shocked that it was 1 out of 4 compared to 1 out of 200 with you. So that really stuck out to me. Um, Here's some more statistics. Um, one of the basic statistics that I would like to bring out to you is notice the average income, the median income, $29,740. Now, not to mention, this is a fixed income typically, and sometimes it's not inflation's not factor into it. At least, if you're still part of the workforce, you can still have a chance to try to kind of close that gap. But it definitely explains a lot what our older population is dealing with. Um, yeah. So why older adults get sad? Here are some of the reasons. Some of them is due to loneliness. Because you got to keep in mind, even when you're working, whether you like your job or not, it is still some form of interaction. Mental health conditions, grief and loss of a spouse, but I'm also going to add friends too, because you got to think about how that plays on the psyche. So if when you go to a class reunion, it's something like if you start off with 100 and all of a sudden now you're down to 50, you know, that's the other thing that I think kind of plays a role in why the elderly or the aging population is really sad. Loss of self some autonomy. There's just certain things that you can't do on your own and just coming to that reality of that. And of course, chronic illness, pain, um, cognitive decline, financial hardship, like what I mentioned with the statistics. All these factors play a role in feeling sad and depressed. And I'm gonna add anxiety to this as well. So older adults are at more of a risk of previous suicide attempts, physical health conditions, So it's very rarely you only have one health condition, just kind of like in mental health, typically depression and anxiety go hand in hand. Same thing with being diabetic and maybe having some heart issues. Um, and like I mentioned, anxiety and depression, social isolation, they're at risk for disability or pain, substance abuse use or abuse of prescriptions, is another maladaptive way of trying to cope with new life, stressful life events, losing a partner, losing a friend. And I'm also going to throw in there losing pets too. Um, and of course, having access to lethal means goes up because, they're probably taking a lot of medications, um, and not to mention firearms as well. Sorry about that. Difficulty adjusting to the change of new life. So we're going to kind of talk about some assessment tools. Um, Give you some examples of those. So these are the assessment tools that I was kind of mentioning, that it's just like a good framework. Um, so kind of give you a starting place. Now, I was looking at some of these questions and I'm gonna be honest, I don't know if I can answer some of these questions myself. Like, like if someone gave me count back from 100 to 50 or whatever, I couldn't do that. Like, I would like you to like I would like for you to count backwards from 100 by sevens. I know I couldn't do that. I slept since then. Um, so bear that in mind too. Like you kind of got to think of it like being familiar with the person. For example, if the person was really had a poor memory before the aging process, uh, they might not have the best memory now, of course. So just some things to kind of keep in mind when you think about these questions. Mm. But definitely, what is the year, the season, date, day of the week, or the month? Those are pretty well, the day of the week may be a little bit iffy because typically, I won't lie, I don't know well, I know the day, but the date, if I'm not at work, sometimes I'm like, what day it is? But just kind of keep those things in mind too. Another one is the PHQ-9, which I'm pretty sure a lot of you guys are familiar with. This is the rating of the depression scale. Like once again, for my um, individuals out there who are not necessarily trained, these are just tools to try to keep in mind, maybe take it to your primary care doctor if you have access to this, or you can take it to your mental health specialist. So that's something to keep in mind. And also too, when you guys are using these tools, kind of ask some clarifying questions. Like, for example, poor appetite or overeating. There's some people that just don't eat a lot. And also consider like underlying health issues too. Like, for example, I have some clients that have Crohn's, and so they don't have the best appetite, but it's not because they're depressed. So those are some other things to kind of consider when you're using these tools as well. Um, of course, there's the GAD-7 anxiety. And I believe most of these you can probably get a copy offline. So, but like I said, it's just really important to ask some clarifying questions sometimes, and to also bear in mind the person's personality and their abilities before the aging process kind of set in. But hey, in doubt, it's always best to take it to their primary care doctor, and it ain't gonna hurt just to double check. So some of the evidence-based practice is problem-solving therapy, teaching people to deal more effectively with their difficulties or problems to reduce symptoms and enhance functioning and well-being. And we're going to get into that a little bit later, what that looks like. Cognitive behavior therapy, CBT, which is one of my favorites, is about forming clear ideas of your own thoughts, attitudes, and exceptions, and the goal to recognize and change false, distressing beliefs. So, problem-solving therapy um, is really good to really deal with the depression because it kind of helps you to check the facts, which is a DBT technique, um, to see if the facts really fit um, what your goals are. And we'll talk about short and long-term goals. Um, and it's brief and effective. You know, keep it simple. Yes. Um, it's a good way to involve the caregiver. So, for example, sometimes, with the aging process, our memory's not the best, but with the help of the caregiver, it really takes a holistic approach. So that's a really good modality to use for both caregivers and plus the aging adult. Team approach. So this can also be used with a case manager or even with a therapist. Team approach. Caregiver, everybody's invited. It teaches problem solving skills, which we'll kind of talk about the 7-step problem solving model in a minute. Easily taught steps, hands-on approach, adaptable to different situations and settings. So when we think about the 7-step problem process, number one, define the problem. Without knowing the problem, you can't solve the problem. You can't move forward. And it really is important to be a little bit more specific. And that's where I kind of like how, for all my people who have done EMDR, how they talk to you about having a specific touch point. And maybe that might be helpful, like maybe focus on a situation, because typically when we get older, we really become creatures of habit. And when our routine is broke, that can cause a lot of suffering there too. So that's important. And I really do like the part of like I said, when you get a little bit specific. So um, yeah. Number two, analyze the problem. It helps you to understand the nature of the problem. Brainstorm. So that's another opportunity to use those qualifying questions. Um, like, why do you want, I don't know, um, Why do you want your pudding um at 2 o'clock in the morning? You know, things like that. I don't know, I can't think of a good example, but you know, why do you want that? Because probably at this phase you'll figure out why that's important. Like it could be um their sleep schedule's off and this is a good time for them to eat, they digest their food better, or it could be a medical reason on why. So that's important. And then brainstorm because maybe the facility that they're in, um, or maybe if they live in their home, maybe they don't have any, their caretaker with them in the home, things like that. You'll get to that part. Come up with variable problems. Just like I said, the third step is prioritize. Why is it important? Um, is it more important for you to get your sleep first and then eat? Things of that nature. Evaluate your options. What is more realistic? Like I said, if you don't have a caregiver there, is it more realistic for you to try to cook a meal or something of that nature? And then 5, select select the best option. 6, implement the solution. And number 7, measure the results. So figure out which process worked best for you. So here are some of the benefits of problem-solving therapy. Confidence that you can handle problems, um, the ability to make effective decisions, which that is super important because when we're going through the aging process, we can sometimes be very hard on ourselves and feel like, oh, I don't know if I can trust myself. I don't know if I'm good at that, and things of that nature. Having a toolbox of problem-solving strategies. So basically, you're going to be proactive um, before the problem comes up. So that's really good. The ability to identify stressful and triggers. That's important. So you are gaining some understanding on why you feel a certain way. And of course, as you know, if you can recognize the pattern in your thinking and your behaviors, you you stand a better chance of changing it and correcting it. A systematic approach to problem solving. So once again, basically having a routine. So cognitive behavior therapy was invented by Aaron Beck in 1970s. It was designed to help um, mood and behaviors to improve. Um, and as you can read, depression, anxiety, address cognitive distortions, um, kind of corrects like things like assumptive thinking, all or nothing, which we'll get to. Um, Collaborative approach, once again, I love that part. Um, Teaching core principles, easily taught steps, goal oriented, and it can be utilized with other therapies and medication management. Oftentimes you'll see, like in DBT, dialectical behavior therapy, EMDR, those all have um, a piece of cognitive behavior therapy intertwined with them. So this model kind of shows you how cognitive behavioral therapy works. So just to put it simple, what you think is going to show in your actions, and your actions is going to show what you're thinking, essentially. So here are some examples. Um, the harmful thought is someone who thinks like this feels down and sad and rejected. Well, let me go back. The thought is he ignored me. He doesn't like me anymore. The feeling is someone may feel like they're rejected and feel down about it. And of course, if you feel like you're being ignored or he doesn't like me anymore, you might feel withdrawn, you might avoid. Um, and the biggest thing is you may not really be addressing the real core issue behind it. But the neutral, or what we would call the cognitive reframe, is like he didn't notice me. Maybe he's having a bad day. I should give him a call and find out how he's doing. And just I want to point out a little caveat, notice instead of assuming he's going to ask. These thoughts don't cause any negative feelings either. So basically, you're not making those assumptions like, oh, I just know he doesn't like me, or hey, he's just ignoring me. It could be something totally different. Um, the other neutral thought, this thought makes you get back in touch with the person to find out if everything's okay. So, and so yeah. And now with the cognitive behavior model, when it comes to the aging process, so I'm going to kind of speak from the caregiver's perspective. Sometimes we make the assumption, and I mean, you know, no judgment calls, DBT again, dialectical behavior therapy, no judgment calls. Sometimes we assume that, oh, well, yeah, mom knows better not to give her social security number out to the person on the phone. Um, but that may not be true. So we're just assuming that the mom in her 30s would know what to do, mom in her 50s. So it doesn't hurt to just check in. Hey, mom, I know you might know that you shouldn't give out your social security number out to someone, but I'm just double checking just to remind you, you might not want to give your social security number out to someone. And now when the feeling part comes in at that way, mom doesn't feel like you don't value her or you think she's dumb, you're kind of opening a conversation about safety. Um, and the behaviors, hopefully mom is receptive to it. And also, once again, it invites a problem-solving approach to it. So that's something to think about. And also from the aging adult, um, vice versa, don't make assumptions that, you know, your caregiver knows what your needs are. So it's just really important to have that open communication and ask those questions. So So when we are trying to, when I say we, therapist or even a caretaker, so once again, what we really want to do when we're trying to figure out things, to build a case or figure out what's going on or what's needed, we like to assess. And like I said, we can use some of those assessment tools. Um, make the list of maybe possible triggers or stressors, um, assessing where the aging adult is for us cognitively, you know, and then assessing the behaviors, meaning the ABC model, basically what happened before that might have triggered the event, and then the also the C is the consequence or the outcome. Was it good? I mean, was it helpful or was it not helpful? And then after that, we can go into developing some strategies, establishing a treatment plan. And then once we try some of those strategies, we can kind of figure out what works, what are the barriers, what do we need to tweak, what do we need to throw out. And then also, which is really more important, is assessing the attitudes on aging. Um, don't be afraid to have those difficult conversations, or I like to call them courageous conversations, with your loved one or the person you're caring for, and see what they think about it. So definitely person-centered approach. Talk about some key components of CBT for older adults. Cognitive restructuring. It just basically helps the client to look at it from a different point of view, more of a positive point of view. So, for example, like the beauty of getting older, it could be, hey, I can really learn a hobby without being graded. For example, I love to sew, so I took some classes and I audited because it was great. I didn't have to get a grade for it. It was completely for enrichment. So that was my cognitive reframe for it. It's like, okay, instead of me looking at the challenges, it's like, oh my gosh, I won't be able to keep up with my classmate. They're so much younger than me and all of that. I just was like, eh, but the beauty of it all, oh, I had to get graded for it. Great. Behavior activation, encourage older adults to engage in meaningful activities. Guys, there's so many. Like sewing's one. Um, like I like to crochet and knit, and I mean, reading, it could be different things, or heck, it could be something as simple as taking, I call it a mindful walk, and setting goals like, hey, I'm going to take a walk and see how many trees I can count on my walk. Meaningful. It can be something as meaningful as that. It doesn't have to be anything earth-shattering, like solving, cancer, solving, anything like that. So relaxation techniques. Definitely that's where your mindfulness comes in, which I'm pretty sure a lot of you guys are aware of. Um, Deep breathing, mindfulness breathing, the box counting, s- you know, meditation. Um, Also, meditation could be another form of prayer. Um, Mindfulness exercise, just like what I mentioned just a minute ago. And then problem solving skills empower individuals to approach challenges with a systematic and constructive mindset. Basically, being purposeful. Social skill training, enhanced communication and interpersonal skills. That could be something as simple as maybe taking a trip to Walmart and just practicing asking where a certain item is. That enhanced communication. Interpersonal skills, like I said, don't be afraid to ask those clarifying questions and things of that nature. And we're going to talk about developing the timeline. You're going to really see that's a good place where to develop some of these social skills as well. So making modification for older adults. Reduce writing requirements. Do worksheets together. And what I really think about most is when we're doing a trauma focused narrative and trauma focused CBT, oftentimes the therapist is writing it, so the older adult doesn't have to do that. So that's another thing. And also do a verbal. I mean, you can go over the worksheet verbally. Large printed worksheets, learning with repetition. That's where the routines become very important. Learning multiple modalities. Like I'm very much a kinetic learner, so me myself, I learn by doing, um, opposed to hearing it. I can hear it, but if I can see it and I can touch it, that's my learning style. So I like that a lot. Written instructions, worksheets, pictures, videos, and verbally. Um, Doing coaching call reminders. So as a caretaker, you can, hey, dad, don't forget to scoop the kitty litter, something along those lines. Or hey, don't forget to take your morning meds. The use of wisdom timelines. So I feel like this is very important because oftentimes our um our aging adults, we have careers. And it really does become part of our identities. It makes us feel like we're contributing. So when we lose a big part of that, we often feel like we're not needed, you know. And so I think it's really important for um, our aging adults to feel they're needed, hence the use of wisdom. Timelines is a great way for them to share their strengths. Timelines can be useful as a way of recognizing stress and internal resources. Therapists and caregivers to expect change, even in most discouraging situations. Useful as a way of assessing the meaning or impact of an event. Um, Homework is a good homework assignment. You might find that um, older adults is really helpful for them to see where they came from and what they contribute in their lives, what worked for them, what didn't work. So that's a great homework assignment. Um, of course, it's gonna note good and bad challenges and events in life. But I also think that's a good way, it's a really good opportunity to segue into um, the challenges that they may go through health-wise is just a challenge. It's an event. It doesn't necessarily have to be the end necessarily. Encourage self-compassion. Hey, hey, it's okay. You're not the 20-year-old. You're not going to run the marathon. I have no idea, but you're not going to run a marathon in 20 minutes. You might have to walk and run the marathon in 30 minutes and really just help them to focus on the finish, the finished goal, the finished product. But also stop if stirring up emotions cannot be handled. So this is also a good way to learn about the individual. Um, Maybe it has changed emotional wise. So, for example, so I think too much. So I thought about why is it that if you ever notice, like when it comes to, when it comes to when you're older, you know, you can recognize fraud more and you're on your game. But then when you get older, you just kind of like, okay, whatever, fine. And my theory is, I call it the Anita analogy, is your hormones change. So for example, like when it comes to testosterone, that's the hormone we know that gives you that spitfire and vinegar, right? But we know as you age, these type of hormones decline. And that's another thing that people don't think about because you think about, oh my gosh, she should have known better not to give out her social security number. Why did she do that? Because I think that you lose some of those hormones. So that's something to consider too. And that also goes along with your emotions too. As we know, you lose estrogen and testosterone, those type of things affect your emotions. So something just to kind of keep in mind as we go through that. So how do we make use of the timelines in CBT? Step one, we develop the timeline homework, acknowledge strengths and resiliency. That's super important, especially when you're feeling like you don't really have much to contribute. And you really got to consider that with your adults that may have some physical ailments or some physical impairments that might keep them homebound. Step two, consider specific experiences from the past that evoke some emotion. Examine them as factually as possible. So, yes, therapy is about feelings, but we also want to check the facts and make sure we're not enforcing cognitive distortions. Step three, when examining past experience, agree to certain rules apply. Reflection rather than blame. Shame is not helpful or constructive. No hindsight basis. Assess on what was known at the time. So, you know, so just recently, my aunt had a birthday, and one of one of her children had brought up about how, well, hey, we always got in trouble, but you never explained. And I thought to myself, that's not helpful because, they only did what they thought was best. Um, so I thought that was a good example of the blame and shame. Step four, ask client, is there a time in their life when they cope with adversity? That is super important because that's going to highlight their resiliency. And it also highlights how they were able to get through it. And that's really important when you're talking about suicide as well, because you want people to remember, yes, that was just a snapshot in time, just a time period, but you did get through it. Step five, can these skills, competencies in handling ambiguous situations help the client deal with their current problems? So basically, it forces the client or the aging adult to look at, was there a step that they use to get through one particular problem? Can that be useful for this this challenge that they're trying to get through? And these are just some examples of some timelines that you can do. Um, you can definitely Google a timeline template. So here's some key questions to ask when reviewing the timeline. So what to do in a crisis time, so I think An important question to ask is the crisis question. Number one, it really reminds them that, hey, I did have some good points. And on top of that, it helps them to remember their contribution to help another person at that point in their life. So I think that's highly important. Um, and also asking the crisis question also reminds them that they are resilient and still can be resilient and they can get through whatever the challenge may be, whether it's a mental health challenge or whether it's a medical challenge. So this is just example of cognitive distortions. Cognitive distortions are often deeply ingrained and can significantly impact an individual's mental well-being. Addressing cognitive distortions involve recognizing and challenging these distorted thoughts through strategies such as therapy, mindfulness, exercise, challenging, journaling, and social supports. So the all or nothing thinking. Oh man, I will never, ever be able to do a marathon. That's all or nothing. Well, maybe you may not be able to do a marathon. Maybe you may be able to, instead of do a 5K, you might be able to walk around the block. Really just focus on what they can do. Overgeneralizations, I think that's kind of self-explanatory. Catastrophizing is a big one. Oh my goodness, if I get older, my husband is not gonna love me anymore or whatever. Just over catastrophizing it. Just the world's gonna end if, if I don't do it like I did, like I was in my 20s. It's all about really just being able to adjust and really kind of get them focusing on the problem solving. And then there's mind reading, labeling, magnifying or minimizing. So I want to talk a little bit more about the minimizing piece of it. And now this goes back to really being brutally honest about what you can and cannot do. And it's okay. So if you minimize the situation, you might not get the help you really need. But if you magnify the situation, you're going to have the cry wolf syndrome with people. So people are going to think, oh my gosh, she's blowing this so out of proportion. And they're not going to really believe, like, that you really, 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 really need the help. So that's important too. And stay away from the should statements. Focus on the here and now. Be mindful about that. This is just an example of how um, the cognitive model works. The adversity, the negative thought, I didn't get selected for the choir. The belief is, I have a terrible voice. I'm never going to be any good at singing. But once again, check the facts. The facts. This is what you believe. This is a feeling. Consequences. You feel sad, you give up on practicing or singing. So it's really important just to remind the Asian adult, hey, it's okay. We just have to modify it a little bit. Hey, you might not be able to do that marathon, but hey, you can always get out and walk the malls or walk, walk the track. Um, let's see. And now, of course, the automatic thoughts. And that is also what is meant by, example, I made a mistake at work. The automatic thought is I'm probably going to get fired. I always mess up. This is it. I'm no good at this job. But the new thought, I messed up, but mistakes happen. I'm going to work through this like I always do. So I think that's something to keep in mind. And this is kind of a good example of like checking the facts, so to speak. It's a thought based on facts. What evidence do I have to support it? What evidence, what evidence do I have against it? What conclusions am I jumping to? Assumptions. What's the worst that could happen? See, now you're kind of entering into the problem solving piece of it. Is there a more positive or realistic perspective? So now you're trying to dial in what is really behind the thought, possibly. What advice would I give a friend in the same situation? Problem solving. Getting older brings a lot of challenges, but they don't have to be horrible challenges. They can be good challenges. Um, so I really like this book, but I think my time is short. But it is the book Love You Forever. And what I love about this book, if you guys can see it, is the book is about a mother that is caring for her kid, and it talks about the various stages through his life, you know, elementary, middle, and high school. It talks a lot about that. But then at the end of the book, it also shows where the mother is aging. And now it's the son's turn to be the care, to be the caretaker, I mean, the caregiver. Um, I just really want to leave you with, remember, we're all going to get through this. We're all going to get there, and just kind of have some little bit of grace for the people you're caring for. So that kind of concludes everything. I'm kind of opening it up for questions. Are there any questions for me? I'm going to try to.
If anybody has any questions, you can write them in the chat. Looks like Anita, they want to know what is the name of the book. Can you just type that into the chat so everyone can have it?
Sure.
It'd be great. Perfect. Does anyone else have any other questions for Anita? Looks like, has anyone engaged with the volunteer Give 5 for older adults?
Not quite understanding the question.
Not either. Carol, if you can give us some more information about that, that would be great. It's a way to give purpose.
Yeah,
For older
I see
adults,
what you're saying, like volunteering.
volunteering for older adults, I believe.
Yes. And that's the other thing too about I was thinking about routines. So I know people kind of get down on watching TV, but if like an older adult is bedridden, believe it or not, it still is a routine. Like maybe watching certain shows, you'd be surprised how that can definitely um it still is another form of a routine though. Wheel of Fortune, yes. I ain't gonna lie, Family Feud is my favorite. Y- You know, when I was talking about older adults, I'm thinking 65 and older, but I'm glad you mentioned that because I call it the middle. Here we go again with my Anita analogies. I call it the middle invisible population because that population there were, they're not exactly considered to be in their 20s, but then they're not exactly to be considered to be elderly either. And sometimes I call them invisible because oftentimes that population is expected to know certain things about computers. You know, I mean, I don't know if anybody else has ever gotten it was, Anita, you're not that old. You don't know how to do that? No. And sometimes that can make a person feel bad, but something to think about because that's that that's the really weird middle age. I call it the middle child syndrome, you know?
Anita, Jody had a question about things we should definitely not do when working with our elderly population. Can you think of anything you want to definitely step away from and not do?
Don't assume, good or bad, like the example I gave. Don't assume that just because I'm at this certain age and I'm still working, that, oh, yeah, of course you know how to do a PowerPoint or anything like that. Um, I think that's important. Also, the flip side of that, like I said, even though I know it was a credit card company, but they just assumed that everyone would have a phone. So I think it's very important not to assume. Do not be afraid to ask questions. Have a conversation. Do not talk at them. Have a conversation with them, which I'm a part of. I don't want money to be different than my parents who don't. Yeah, Carol, quality of life is huge. And that's why we make those suggestions of having those social supports, reaching out to the church. And fun little fact, here's something else to consider. The reason why a lot of fraud happens with older adults, has it ever occurred to anyone that they're lonely, so they'll just talk to anyone? So once again, that's something to consider. So, like I said, don't assume, oh my gosh, you should have known better. Ask, why did you give out that social security number?
Okay, it looks like we're going to be able to wrap up here. Again, thank you so much to Anita for this amazing presentation. I've learned a bunch. I know I personally am dealing with an older adult at home, and I guess I am considered an older adult too, which is kind of weird. Anyways, we have this webinar. It is recorded and you can access it at mentalhealthkc.com website. You can also, I put the website link for the certificate of attendance in the chat with the password. And our next webinar is on the fourth Thursday of the month in September from noon to 1. We hope to see each of you there. And again, thank you to Anita for a wonderful presentation. And we'll see you next month. Bye-bye.
Bye.